Well, I have been at world conferences on pain, and there is as you said before, there's people who think it's psychological, people who think it's physiological. I think the biggest problem when dealing with this condition and the patients is actually taking the time, which is a luxury now in the medical system right now, and understanding the individual condition. We have to understand the person's mentality, how they deal with stresses, what their specific stresses are, and understand that the solution is not a pill. It's lifestyle issues. It's a combination of health, which includes diet, nutrition, proper nutrition, appropriate for that patient. We're dealing with exercise, appropriate exercise for that patient, sleep, which is a huge detractor to this condition. And also, there is appropriate medication that is required. But to go beyond that, we have to look at taking this condition and dealing with it as more of a multimodal type of a situation. You'll hear doctors talk about multimodal or multidisciplinary factors. There's a time and a place for each doctor to be part of this treatment regime, and we have to then match the doctors and the practitioners to that patient. What I hear so often is that patients have tried this modality, this medication, they've had active release, they've had cranial sacral, and they've tried it once and said, it doesn't work for me. And what we have to do as practitioners and doctors is link the patient with the appropriate practitioner who will give them, first of all, the best therapy. And what that is there's people who are better at different therapies than others. There's people who have personalities that will match with the patients. And what I think is interesting is that we can't download this on the GPs. They do not have the time and they don't have the expertise. This is where the patient has to be empowered in order to educate themselves within limits, because you can go onto the internet and scare yourself beyond.